So I want to talk to you about functionalist and social conflict theories perspectives on medicine. For functionalists, again, if we are, as a society, we care about literally the health of society. We want society to be healthy and able to sustain itself, which means we actually do care about the health of the people, and we should. In conversations about the economy, for instance, we're talking about resources, who gets what, making sure that everybody gets what they need, and the economy is just about trying to manage those resources. And politics is about who gets those resources, when and how. And so when we talk about medicine, or we talk about medical care, or what type of healthcare system do we have, we are generally asking those questions about who's responsible for it, who has a right to health. We assume that everybody does. Who's responsible for it? It's a question of who's going to pay for it, right? So functionalists, there's no question, disease and illness is bad for society. When we want to look at the health of a society, we often will look at their health indicators, literal health indicators, when we want to know how a society is doing. We look at things like the maternal health rate, or infant death rate, or we're looking at incidences of disease. And we saw a lot of that epidemiological sort of considerations during the COVID pandemic, if nothing else, if you haven't paid attention to anything else. So disease and illness is dysfunctional for a society. That's not very surprising at all. There is something that I want to talk to you about um, in this idea of medicine and when someone is sick or not sick from a functionalist perspective. There's something called a sick role. Remember, you've got some statuses, and for each one of those statuses, you have a certain amount of roles or just general expectations of the things that you're supposed to do. The sick role is something that a functionalist might talk about. We get this from Talcott Parsons. You don't have to remember that name at all. But a sick role, remember expectations of behavior, a sick role is the pattern of expectations that define appropriate behavior for the sick and for those who take care of them. So if your status is sick, then you have a temporary role that goes along with that status, the same way that all of your statuses carry roles. And more importantly, the sick role excuses you as the sick person, excuses you from your normal obligations. So if I'm a professor, I have a certain amount of roles, expectations of my behavior that I need to carry out as a professor. If I'm a mom, I have a certain number of roles or expectations of my behavior that I'm expected to carry out as a mom. If I'm sick, that status gives me temporary excusal from my professor and maybe my mom role expectations, right? It excuses you for a short amount of time from your normal obligation. But because of that, you've got a new set of roles. Status sick excuses you from your other roles, but it gives you a new set of roles. These are those that you need to get that you need to satisfy in order to maintain that sick status. Number one, you must want to get better. In order to have the sick role, to temporarily excuse yourself from your other status expectations, if you will, you have to want to get better. You can't be sick and sort of just say, well, I'm sick. Nobody should be able to expect anything from me. If you're like that, if you're sick and you're just gonna forever be sick, then you won't be granted the sick roles excusal from your other status obligations, for instance. In order to maintain that excusal from your other obligations, a person, in order to fulfill their sick role, must do sick people things like stay in bed or eat chicken soup or sleep a lot or sniffle or have watery eyes. You got to look miserable. If you're telling people that you're sick, and because you're sick, I can't turn in my homework on time, and you look fine, and you're not doing things that sick people do, you're not resting, you're not staying in bed, you're not sniffling, you don't look miserable, then your sick status is not likely to be given to you or ascribed to you. Nobody's going to acknowledge it because you're not satisfying these expectations of you in that way. So you must want to get better. And the reason why is because this sick status is very temporary. It lasts for a very short amount of time. Um, if you're sick for too long, at some point, socially, we're going to question whether or not you should be able to keep the sick status. And people at some point will start saying things like, well, I don't know, you need to figure out how to get up while you're sick. Maybe you need to go to bed sooner, or maybe you need to take some medicine, because you're not going to be granted the sick status for very long. So you're not going to be able to keep this sick role for very long. And remember, we were talking about power and authority being based in legitimacy. You have to, your sick role has to be legitimized in the ways that you should be very concerned with medical professional help. Again, the institution of medicine, for instance, is how we prevent and treat and diagnose illnesses and promote health. You can't just have sickness and illness forever. You got to be interested in the prevention of it. You got to be interested in figuring out what it is so that you can treat it. And that usually means that you need to see a doctor, right? And the reason why we want you to see a doctor is because that physician has the legitimate right to be able to say what's wrong with you. The person down the street, they don't get to just say what's wrong with you. We might listen to what your grandmother says or what your mother says, right? We assign them some legitimacy of being able to make those kinds of diagnoses, for instance. But the point is there needs to be something to legitimize this sick thing. If you don't meet these criteria, to the satisfaction of the social people around you, the people who you share status sets with in these institutions, your professor at school, your group members in your student group at school, your supervisor, your manager at work. If those people don't think that you are appropriately meeting the expectations that this sick role assigns for you, if you don't play by these rules, then you are otherwise going to just be assumed to be lazy or that you're making it up, right? You're just being lazy and you're trying to get out of the other expectations that you have. Some people, we've talked about the stigmatization of illnesses. If you have a particular illness, you can be granted the sick role that will keep you from being responsible for some other things. But remember, we talked about illness is about that social response when we were talking about the symbolic interactionist approach. Sometimes you don't want the sick role. Sometimes you might say, you know what, that's okay. I'm going to get up. I'm going to work anyway. That's okay. I'm going to school anyway. Maybe you don't want it because you don't also want the stigma that comes along with being sick. I'll just act like I'm not sick, for instance, because I don't want people to think that I'm making excuses. I don't want people to think that I am faking it. Or although people are okay with someone who has a cold, they're not okay with every illness. So if I am having a flare of an illness, for instance, that doesn't carry that social okay, that I might try not to ever take on the sick role because I don't want the stigma that comes along with it. I don't want anybody to know that I have this illness, right? But disease and illness is dysfunctional for society. And so, just like we will structure the society with an expectation of these statuses, you can be granted a sick status with a new set of roles, but it's just not that simple, okay? You must want to get better. You should do sick things like stay in bed. It must be short-lived. Sick role can't last forever. And you must be interested in seeking professional help because physicians, for instance, can legitimize your sick role. Social conflict theorist. What might a social conflict theorist say? If we remember that social conflict theorists, as inspired by Karl Marx, and after we've talked about the economy, is going to be interested in, again, sort of economically, how do we make sure that people get what they need, and who is politically making these kind of choices about who has the right to what and who's responsible for it. Social conflict theorists who are looking at medicine might be concerned with issues in the healthcare system, specifically as it relates to the capitalist society. So, a term that I want you to remember here is this idea of commodification. The changing of something that is generally not thought of as a commodity into something that can be bought and sold in a marketplace is what we think about when you talk about commodification, right? Um, and it could be anything. If you think about a person who cleans their house, I clean up, like I get up, I sweep my floor, I mop my floor, whatever. It's the thing that I'm supposed to do in my house. The moment that I then choose or sell cleaning services, I have commodified that thing. And this isn't new. I'm not using this example as it's like a brand new thing that I just came up with. Commodifying cleaning services is the process of attaching some ability to earn a profit from those behaviors that otherwise may not have been bought and sold on, on the marketplace at any time, right? The reason why this is important for conflict theorists when we're talking about something like medicine is because in a capitalist society, they are interested in the ways that pharmaceutical companies, for instance, just by example, might be very interested in the things that we medicalize or not, right? Pharmaceutical companies are obviously very interested in those things that we consider to be healthy or not healthy because they want to help keep you healthy, but maybe not, the argument is that maybe they're not so interested in curing you of your illness or your disease because then you won't need the medicine anymore, right? At what point do we consider something to be not bad or deviant, but something to be in need of medical treatment means that we can commodify that medical treatment. Somebody can then be very interested in how we treat it, what we treat it with, and whether or not there's some money to be made for it. Can we trade on the marketplace treatments for this money? The truth is, whether you think that there's a conspiracy about pharmaceutical companies, for instance, trying to keep people just a little bit unhealthy so that they all always need some medicine, what we know is that healthcare costs money. When we talk about those resources, what kinds of resources do people need to keep themselves healthy? Everything from water, because we live in a society where water can be owned, or just the ability to keep water sanitary, the ability to plant certain crops so that you can use them for medical purposes, the ability to make certain drugs or any kind of treatment, the surgeries, whatever. Medical care costs money. And so that conversation about making sure that those resources are distributed in ways so that people can use them, those economic questions that lead to those political questions as to who's responsible for it, who is going to pay for it. That is, social conflict theorists want to understand how those processes are happening, but clearly this stuff takes money for us to be able to do it. Doctors do need a lot of expertise to do what they do, which means they must go get a lot of training. And we've talked about it in education. That training is not necessarily free. Healthcare and research does cost a lot of money. And so we're always right back to this question of public versus private healthcare, or universal healthcare versus socialized healthcare systems. Everybody, we think, has a right to health, has a right to be able to take care of themselves. Sure. But the question is right back to who's responsible for paying for it, because our resources are finite. And so we always have to ask that question.